Namaste, I am Sreejith Edamana, Chief Operating Officer of Apollo AyurVAID Hospitals. At Apollo AyurVAID, our promise is predicated on delivering truly patient-centric care for all the people coming to us. We have been able to consistently deliver this to over 4 lakh patients who have come to us over the last 20 years. Consequently, we are also able to deliver 98.6% satisfaction. That's like really benchmark in the industry where people have rated us as excellent or very good for the care that they have received. So what's the hallmark of this patient-centric care? So at Apollo AyurVAID, our protocols keep the patient at the center. So what happens that if the patient is coming for a particular disease, we are not just talking about disease, say diabetes. We are also talking about the patient having diabetes plus other conditions that he or she may be going through. For instance, 80% of diabetics also have broken metabolism as a concern. Likewise, 50% plus of them have fatigue as a major issue. And they may also have some other comorbidities that they may be having on a day-to-day basis. And at the end of it, what is happening is that with this kind of a cluster of conditions or symptoms that the patient may be going through, their overall quality of life is also suffered. They're not able to sleep well, digestion, talk about it, right? Stress, the whole bowel movement, many of them get compromised. So at AyurVAID, we are able to take all of them, address all of them together in our whole person care approach. So that's one of the hallmarks of our patient-centric approach. Now, how does we actually deliver this care, right? So it starts with an in-depth discussion with our expert physicians who are also trained on our award-winning protocols. So there's a very, very in-depth conversation which almost spans 45 minutes to an hour, where the doctor actually goes through the complete history of the patient, what are the day-to-day symptoms as well as the disease symptoms that the patient is going through. They go through the biomarkers, other evidence that is available to formulate a complete health status of the patient. Once this health status is arrived at, the doctor and patient will again work together to arrive at what is the best way to approach, the best way to deliver the care for the patient, right? So they'll make a health plan jointly, which is signed off between the doctor and patient, saying that we will go with this plan, which may be including diet, lifestyle, panchakarma therapies, as well as medications as required or as advised for the patient. And what more, apart from this, we also will put out very objective outcomes to be tracked, which are targeted as part of the treatment. These outcomes range from standard outcomes, which are par for the course for the condition, biomarkers with which the patient would have been baselined at. Also, in truly patient's words, what does good health mean for the patient? So there are a lot of patient-reported outcome measures also which are brought into these parameters. Once this is signed off with the patient, this is thoroughly reviewed throughout the care delivery cycle, be it the patient on medication and coming back for reviews, be it the therapies that the patient is going through inpatient or outpatient basis. This is very systematically reviewed, and if there is anything that is not going as per plan, the doctor is able to make corrections as and when required, so that we are collectively going towards a common goal. So what at the end of it, what achieves is an informed decision for the patient. Patient gets much greater understanding of their own health status, as well as what is that the patient truly deserves to achieve at the end of the day. So this has been our strength, and which has been widely appreciated by all the 4 lakh patients who come to us over the last 20 years. So in case you are having any condition or any difficulty that you want solutions for, I would recommend please come to us and go through one of the consultations with our expert physicians. I'm fairly sure that you will be able to observe a big difference, at least on the understanding to begin with, and subsequently the health condition itself. That's our promise, and we stand to it. Thank you.